Hello, everyone, and welcome to Primetime Health Supplemental, where we explore some of the concepts that we cover in Primetime Health in greater detail each week. I'm Julie Dalton, certified health coach, and I will be your instructor for today's presentation. Today's topic is House of Hoarders, understanding the connection between obesity, type 2 diabetes, and heart disease. There are two types of diabetes, type 1 and type 2. As prime timers, it's important for us to understand the difference, so let's talk briefly first about type 1. Type 1 diabetes cannot be prevented or cured. It is often, but not always, diagnosed in younger people and happens when the pancreas is unable to produce the master hormone called insulin. The cause of type 1 diabetes is not well understood, although genetics are thought to play an important role. All type 1 diabetes sufferers require insulin injections for the rest of their life. Type 2 diabetes has an entirely different origin and can be considered a gateway disease to many other age-related illnesses. Type 2 diabetes is a major obstacle to achieving good health in prime time. First, it is vital to understand that type 2 diabetes is almost 100% preventable and can even sometimes be reversed with dedicated lifestyle modifications. Unlike type 1, where there is not enough insulin in the body, type 2 happens when the body still makes enough insulin, but over time, poor lifestyle has caused the cells of the body to be unable to respond to the insulin in a healthy way. Genetics may play a factor in type 2 diabetes, but overall, the vast majority of cases are caused mainly by poor lifestyle, specifically inactivity, obesity, and chronic, unresolved stress. Type 2 diabetes can be controlled either with oral medications or, if the condition is poorly managed, the pancreas will eventually wear out and injections will become necessary. Although they have different origins, both types of diabetes have some important things in common. Most importantly, both types can lead to very serious health complications if they are not well managed. They require careful medical supervision and healthy lifestyle changes. The symptoms for both types of diabetes are the same, and they include thirst, fatigue, frequent urination, and blurry vision. It's most important to know that with type 2 diabetes, we often get warning signs that we are headed in the wrong direction. We will discuss these pre-diabetic signs in more depth in our presentation today. But first, let's look at what is happening in our state with diabetes. In 2018, the Arizona Department of Health Services reported that 600,000 adults had type 2 diabetes. The thing that shocked many in the healthcare industry was that the AZDH released a second study the following year, reporting that 120,000 new cases had been diagnosed in just 12 months. That is a 20% increase in just 1 year and works out to be about 10,000 new diabetic cases in Arizona every month between 2018 and 2019. And that is just the tip of the iceberg. The statistics on prediabetes are even more shocking. You may not have ever heard the term prediabetic before. Doctors often use this term interchangeably with the term obese or overweight. So if your doctor has told you that you are either of these things, the chances are very good that you are also prediabetic. The Centers for Disease Control estimate that a whopping 1 in 3 adults nationally has prediabetes, and of those people, 90% of them don't even know they have it. The AZDHS translates that to mean that 1.9 million Arizonans who are now walking around with no symptoms, totally unaware that their health is literally about to go to pot. It is vital to remember that, especially in the pre-diabetic stage, type 2 diabetes is preventable and reversible. But how can these adults prevent a disease they're not even aware they have? What will it mean to Arizona in just a few years if all 1.9 million of these people suddenly blossom into full-blown type 2 diabetes? If you or someone you love is diabetic, you already know how costly this disease can be. Arizona's diabetics currently pay $5.1 billion annually in doctor's visits, medications, diabetic testing supplies, and hospital care. And they lose another $1.7 billion a year in indirect costs such as early disability, absenteeism from the workplace, and lower productivity while on the job. Think a minute about what this means to you. It means that diabetes is making you poorer in two directions at the same time. It diminishes your ability to earn a living, and it makes that living much more expensive. After all, testing supplies, medications, doctor's visits, and hospitalizations are not cheap, and you are getting squeezed from two directions at the same time. Let's explore some of the ways that your uncontrolled diabetes can reduce your ability to earn. For many people with diabetes, the perspective never goes much past the task at hand. They count their carbs. They maintain a stable blood sugar most of the time. But what about the big picture? The truth is that if you do not learn to stabilize your blood sugar as a new and vital way of life, your diabetes will become a gateway to vascular disease, which can lead to other diseases in prime time, such as blurred vision and blindness, gangrene, amputation and disability, kidney disease, stroke, dementia, heart attack, and premature death. Translating that into cold, hard facts, the AZDHS has estimated that the risk of death for an adult Arizonan with diabetes is 50% higher than for an adult who does not have the disease. The good news is that type 2 diabetes can be prevented and even reversed if you are dedicated. How does type 2 diabetes lead to all of these catastrophic problems in your body? Think of your body as a beautiful house, a home for your soul. In this house are many rooms, your cells, and hallways, your blood vessels, that lead from room to room. The hallways must be kept clear at all times so that they can transport nourishment, glucose, to each room in your house. Your pancreas manufactures trillions of tiny keys called insulin that unlock the door to each room in response to the carbohydrates that you eat. The insulin deposits the glucose into your rooms in just the right amounts to help you function optimally. When you consume too many carbohydrates, however, the rooms of your beautiful home become packed with too much of a good thing. The clutter builds up until the doors of your cells become harder to open. We call this insulin resistance or pre-diabetes. As you continue to accumulate clutter in your rooms, eventually the extra glucose backs up in your hallways and stairwells. Insulin, wanting to keep your hallways safe, clean, and tidy, begins to look for somewhere else to store that extra glucose, to get it out of the way. When your blood vessels become cluttered with glucose, insulin stores the glucose in your liver and your belly fat. Think of these tissues as storage rooms in your house. When we have more stuff than we know what to do with in our house, we may store it in the attic or the basement, the hall closets, or the garage, or in the junk drawers of our kitchen. These are all places where you store things that you don't really need and that you'll never really use. This is why a person who is pre-diabetic often has excess belly fat from years of overstorage. Eventually, even these extra storage rooms get full, and glucose, which now has nowhere to go, finally begins to spill back out into the hallways. At this point, your body, this home for your soul, is overrun with more glucose than it needs, and you have achieved hoarder status. You have become a type 2 diabetic. But why does diabetes cause all of these other diseases? It is because everything that happens in the body is based on a chemical reaction. The glucose that piles up in your hallways does much more than just sit there. Through a process called glycation, the extra glucose actually binds with aging proteins that float around in the bloodstream and form a sort of sticky new garbage that begins to line the walls. The glucose and the aging protein sludge pile up in the corners, narrowing the blood vessels and making it more and more difficult for the blood to get where it needs to go. This glucose protein sludge begins to break down the lining of your arteries, making them rough and hard, much like rot or corrosion would damage the floors of your hallways with time. Glycation begins to damage the walls and the ceiling of your hallways too, making passage for your blood cells ever more perilous. Tiny platelets catch on the rough, damaged surfaces inside your vessels and break open, forming clots. Cholesterol begins to catch on these damaged areas too, further narrowing your hallways until nothing can pass. Cardiovascular disease, then, has less to do with fats in your bloodstream and everything to do with excess sugar and the damage that it does to your vessels as you age. If this process happens in the hallways that supply the outlying areas of your body, the nerves in your legs and toes become damaged, and your feet begin to tingle and hurt. Cuts and bruises take longer to heal. Eventually, gangrene can set in, and appendages will need to be amputated. If the hallways leading to your heart become narrow from this hoarding process, your heart cells begin to die, and you can have a heart attack. If the same process happens in your brain, you will have a stroke, or you could end up with dementia. If it happens in your kidneys, you could end up with kidney disease. When learning to manage diabetes, cutting back on sugar is an excellent place to start. But in order to really reverse this hoarding process, it is necessary to both eliminate the garbage and repair the damage. I'm going to share with you today 4 skills that will help you turn the train around. First, eat right. We all know this. Eat right carbohydrates in the right amounts. Increase the amount of fruits and vegetables, fibers and lean proteins coming into your body. Eat whole foods instead of processed foods. Sip on smoothies several days a week to stabilize sugar and insulin levels. The second skill is to start sweeping and repairing the hallways with moderate exercise. Resistance training 3 times a week will build muscle, which will help you burn more sugar and stabilize blood sugar and insulin levels. It is recommended that you get moderate exercise for 20 minutes a day minimum, 6 days a week. The third important skill is to get an oil change. Switch to healthy fats and oils to help condition and repair the insides of your blood vessels and heal your blood. The fourth skill is to relax. Stress hormones increase the amount of sugar circulating in your blood, so learn to take it easy. The sooner you learn to make these healthy habits a regular part of your life, the more assured you can feel that your beautiful home, the home for your soul, will remain healthy and functioning for many years to come. Thank you so much for joining us today for Primetime Health Supplemental, House of Hoarders. If you are participating in Primetime Health online, please leave comments and questions below in our discussion board. If you are part of a live session, I hope that you will jot down questions and comments you may have and come to our next class prepared to discuss them together. Thank you so much for participating, and we'll see you soon, next time on Primetime Health Supplemental.